Welcome to Mind Mentor. In this video, we will discuss about influenza. It, commonly known as the flu, is a highly contagious viral infection that primarily affects the respiratory system. It is caused by influenza viruses, which belong to the Orthomyxoviridae family. Influenza viruses are constantly evolving, which is why people can get the flu multiple times throughout their lives, and why a new flu vaccine is developed each year to provide protection against the most prevalent strains. Here are some key points to understand about influenza. Types of influenza viruses. There are three main types of influenza viruses that infect humans: Influenza A, Influenza B, and Influenza C. Influenza A is the most common and has the potential for more severe outbreaks, including pandemics due to its ability to mutate rapidly. Influenza B tends to cause milder illness, and Influenza C typically results in mild respiratory symptoms. Symptoms. Influenza typically presents with symptoms that include fever, chills, sore throat, cough, runny or stuffy nose, muscle and joint aches, fatigue, and headache. Gastrointestinal symptoms like nausea, vomiting, and diarrhea can also occur, especially in children. Transmission. Influenza is highly contagious and spreads through respiratory droplets produced when an infected person coughs or sneezes. It can also spread by touching surfaces contaminated with the virus and then touching the face. Seasonal influenza. In many parts of the world, the flu is seasonal, with outbreaks occurring primarily during the fall and winter months. This is often referred to as the flu season. Complications. Influenza can lead to various complications, especially in vulnerable populations such as the elderly, young children, and individuals with weakened immune systems. Complications can include pneumonia, bronchitis, sinus infections, and ear infections. Vaccination. Influenza vaccines are developed and updated annually to provide protection against the most common and potentially severe strains of the virus. Vaccination is recommended for most individuals, particularly those at higher risk of complications or those in close contact with vulnerable populations. Antiviral medications. Antiviral drugs such as oseltamivir, Tamiflu, and zanamivir, Relenza, can be prescribed to treat influenza if taken early in the illness. These medications can help reduce the severity and duration of symptoms. Prevention. In addition to vaccination, preventive measures include good hygiene practices like frequent hand washing, covering your mouth and nose when coughing or sneezing, and staying home when you're sick to avoid spreading the virus. In summary, influenza is a contagious viral infection that affects the respiratory system. It can cause a range of symptoms, and in some cases, it can lead to serious complications. Vaccination and good hygiene practices are essential for preventing the spread of the flu and reducing its impact on public health. If you like our videos, please like and subscribe to our channel Mind Mentor.